Welcome, just another video on upper GI imaging. This is the antrum of a patient, elderly patient, man with known and surveying atrophic gastritis. If you look at this image, it's very hard to see anything wrong, to be honest. You can clearly see that there is atrophy. If you know what you're looking for, you can just see that patchy background fibrosis, the islands in between it. If you use virtual chromo endoscopy, you can kind of a little bit see that pattern better. But here the point about this video is to show you what low-grade dysplasia might look like under the endoscope. So right now, if we just pause in virtual chromo, so you see here the image, we go back to white light, we can flick between them. Maybe you can see something. A biopsy was taken here in the antrum, which showed low-grade dysplasia. So then, of course, it's a challenge to go looking for where it is. Maybe this is actually a way to educate you guys out there on how you can go and take more focused biopsies and what they should look like. So let's just go around this antrum and we'll look for things which could possibly be low-grade dysplasia, and we'll describe them a little bit, not in terms of any complex crests or difficult to understand terminology, but just in terms of what the pattern in the middle of them is. Is it regular, or is it disordered? And if you find something totally disordered, you're either talking about an ulcer or you're talking about a cancer. If you find something that's in the middle, you might be talking about dysplasia, and if you find completely regular things, then probably we're talking about inflammation, because this stomach, of course, is inflamed. And that is the pathology going on here, chronic inflammation. All right, so let's just have a look at some areas which stand out to the eye. It is much easier to do this in a bright virtual chromo endoscopy mode than it is to do it in white light. So let's do it in this case, MBI. Let's go and look at an area potentially which might be abnormal. So let's try this one here. And then let's just hone in on some of these areas. So for example, this one. So here in this area you have the standard regular pattern of the stomach. I'm specifically not using difficult words here, or words which are in any way associated with previous eponymous signs or described signs. I simply want to describe this in terms of regularity. So in the center of this image you see a kind of a pattern where it's darker than surrounding, but it's entirely regular, the pattern which you see here. So this is likely to be not very much. Let's go to another one. Let's just scan around until we find one. This is maybe another one, another zone which you could say, okay, this maybe looks like something. But again, the pattern is pretty regular and it's certainly not totally disordered. It doesn't really form anything. There's a bit of fibrin on the surface, and again you have that darker than the background appearance, suggesting there might be inflammation present. If we keep on going, then we can look at this area. So this area again, you can see right in the center of the screen an area where there is increased vascularity, so it's darker, more hemoglobin present, but again, this is the standard regular pattern extends into this area. But then if we just come back, there is an area which is more standing out to the eye in this image. So if you freeze it, it's another good way to look at these things, is to spend some time looking at a frozen image. And you can see at the, maybe is it 8 o'clock, 7, 8 o'clock, that there's a nodular zone that is standing out to the eye versus the rest of this image. So let's go and have a look at that. And we start to see maybe that this is a little different. If we, right now we're not using a cap, but if you look around the surrounding here, most people are not using a cap, so I'm not going to use one here for now. You can see the standard appearance of the, maybe a little bit inflamed, of the gastric mucosa. And in the middle it's something different. So there is an area which is, I'll try and get it more in the center, where the pattern is not the same, not at all the same. So it's not the same as the standard gastric pattern. It's much more like little dots, and like, of course, what we're looking at here is the vessels surrounding the glands in the gastric mucosa, and you can see that they're all coming together. So they're all much more bunched up and coming together. So this is the classic example of a regular pattern, and so this is almost certainly an area, maybe there is more than one, of low-grade dysplasia matching up to where the biopsy was taken. If we just, we can enhance that imaging using a cap and underwater, but right now I'm going to try not to do that. I can show you that you can also do it with near focus, and so near focus is on, magnification is on, and just control the endoscope tip. Of course, this patient is deeply sedated, so these areas are obviously very difficult to find when the patient is not deeply sedated. All right, and then of course we describe the amount of atrophy in general. So we see here that there is mainly atrophy. It's not so easy to see islands of intestinal metaplasia here. I don't really see too many of them. Therefore, we're talking about global atrophy of the antrum. And if we expect, I mean, this is the classic thing people do. This is their gastroscopy. They pull up, maybe they do this is their photo of a J maneuver. And how much of the stomach have we missed here, right? So you have to insufflate, you have to encourage, if the patient's awake, you have to encourage them to hold the air, but just look what happens. So this patient has a very incompetent lower esophageal sphincter. If you just sit on the air, or CO2 in this case, then you can see it expand more. We still didn't get the greatest view. We still seem to have preserved folds here, indicating that the atrophy is potentially not completely over. You can see how incompetent that EDS is, the reason we can't get the stomach to distend. But if you sit the tip in the fundus, if you want to expand that, which you definitely should do because it's flat things we are missing in these patients, then you can also get that to expand. But you do really have to put the insufflation in that area, sit on it. Right now I have a tubing here for the procedure, the therapeutic procedure will perform on that low-grade dysplasia, so it is not distending as much as potentially a standard tubing would do. But you can see that at least you can get better views if you do proper distension. We can see a little thing here. This is probably a fundic gland, cystic gland polyp. We're not seeing overall anything to be concerned about here. But you must do that. You must distend the stomach, and you must take a structured series of photos as you go up through here, and of the incisura. So when we flip down again, when you find the incisura, you must take these photos and examine it properly, and you must take some structured images of the antrum. Okay, I hope you enjoyed that. Not something you commonly see. So low-grade dysplasia in a atrophic stomach.